Your baby is extra special, and his oral health should be very important to you. We've gathered some information for you on how to keep your baby healthy and happy. When a baby is born, the primary or baby teeth are formed, even though they are not seen. The 20 primary teeth start forming about the 3rd month of pregnancy. They should look like this when the baby is born. Also, the 6-year molar, a permanent tooth, starts developing at the same time of birth. Because of these and other factors, it is important to start caring for the baby's mouth from the very beginning. A baby starts teething at about 6 months of age and continues until he's about 2 years old. These 20 teeth will be the only teeth present in the mouth until the child is 6 years of age. The primary teeth will gradually be replaced by the permanent or secondary teeth up until the age of 11 or 12. Some people believe these baby teeth are not important because they're going to be lost anyway, but these teeth are very important. The most obvious function of the teeth is chewing. A child with unhealthy teeth may be limited in the foods he eats, and eating a balanced diet may be difficult. Oral health is an important part of speaking because speech patterns are developed during these earlier years. If a child loses a baby tooth earlier than normal, the space may become too small for the permanent tooth, which will follow. This can cause the permanent tooth to break out of its proper position or to become impacted. An impacted tooth is locked down in the bone by the other teeth and cannot erupt. Good oral health is not an accident. 4 basic factors are important in making sure a baby starts with and maintains a healthy mouth throughout his lifetime. These factors are good nutrition, cleanliness, fluorides, and professional care. In everyone's mouth there are many living things called bacteria, which we commonly refer to as germs. Some of these bacteria eat the same foods we eat. They're so small we can't see them without the help of special instruments. It has been discovered that bacteria mostly like to eat carbohydrates, such as sugars, starches, soft drinks, candy, cakes, bread, and crackers. These invisible tiny living bacteria in the mouth eat these foods and make acids from them. You have probably tasted acids in foods at one time or another. An example is the sour taste you experience from a lemon. This sour taste is due to acid. Acid in lemon and acid from bacteria in plaque are similar. That small hole or decay that we see on the outside of the tooth can be very big on the inside. It can go down very deep, like a bruise on an apple. Plaque is a clear, sticky material that sticks to your mouth. This plaque is often impossible to see. Still, teeth collect a film which needs to be removed every day because the bacteria in the plaque make acids, which can be dangerous. Plaque can also collect on the gums and cause irritation. You will need to clean your baby's mouth daily to help break up this plaque. There are 2 major types of dental disease which can affect you and your baby: cavities or dental decay, and gum disease or periodontal disease. Such dental disease can be prevented in your child's mouth as well as in your own. Next, we will show you how to prevent such disease. Daily cleaning of your baby's mouth is just as important as bathing the baby. This cleaning is really very simple. When only one adult is present, the child will have to be placed in the easiest position for the adult to keep him still and to have good access to the mouth. The baby can be placed on the lap or on a flat surface. The type of position will depend mainly on the age and activity of the baby. When two people are present, one can hold the baby on the lap and clean the teeth, while the other holds the baby's arms and legs to keep him still. Two adults sitting knee to knee facing each other is a comfortable way of doing this. All you need is a soft cotton cloth and warm water. The cloth is wrapped around the first finger, moistened in the water, and the baby's mouth is carefully cleaned. All surfaces should be lightly wiped: the cheeks, the tongue, and both the roof and the floor of the mouth. Keeping the mouth clean helps to prevent infections caused by bacteria which feed off the baby's milk, cereal, and other foods. Most babies like the feeling of having their mouths cleaned. This cleaning also helps to keep the baby's breath fresh and sweet. When the baby starts teething, care of the mouth becomes even more important. Teething can be a difficult time for your baby. Remember that using medications without the advice of a physician or dentist is not recommended. But there is a simple way of easing the pain caused by teething. When the teeth start cutting through the gums often become swollen and painful. Your dentist or a physician can prescribe medication to relieve the soreness. A prescribed amount should be placed on the painful area by using a cotton swab or a piece of gauze. When the child has about 10 teeth, a small toothbrush should be purchased. This usually occurs about the time the baby is 1 year old. The brush bristles should be very soft, with polished, rounded ends. Also, they should be the same length, like this. The brush is even across the top. The brush should be put against the teeth with the bristles pointed toward the gum line. Then wiggle the brush and whisk it down on the upper teeth and up on the lower teeth. The teeth should be brushed on all surfaces, including the tongue side. In addition, the tongue, gums, palate, and cheeks should also be brushed. A baby will usually start grabbing the toothbrush when he's about 18 months. When this occurs, help him hold it and carefully brush his teeth. In addition, make sure the brush your child uses is soft, so it will not harm his gums. Try to use a toothpaste which contains a fluoride, because this type of toothpaste will help make your baby's teeth stronger and help prevent cavities. Also, if the baby likes the toothpaste, it will make brushing easier. However, if he dislikes it, just use the brush, because the toothpaste is not necessary. When the teeth begin to touch each other, dental floss should be used to clean in between the teeth where the toothbrush bristles cannot reach. Dental floss can be purchased either waxed or unwaxed. Unwaxed floss is thought to be better because its fibers separate during use, like the opening of a fan. Thus, it cleans the tooth better than the waxed floss. Cut off a piece of floss about 12 to 18 inches long. Then wrap the floss around a finger on each hand and carefully pass the floss between all teeth that touch. Work the floss up and down several times on the sides of each tooth. Also, rinsing the mouth can be very beneficial in removing large food particles. This can be done by giving your child a bottle or a cup of water. Rinsing should be encouraged both at home and away. During his first few months, your child will grow faster than at any other time in his life. What you feed him is very important for growth and development during these months. The first food your baby will receive is milk. Whether you feed your baby breast milk or bottle milk will be decided by you and your doctor. Breastfeeding has many benefits. First of all, since the milk is custom-made, it is usually better for your baby. Also, breast milk is typically more economical in terms of money, labor, and time. For the most part, babies usually do better on breast milk. They do not get diarrhea or constipation as often as they do with bottle milk. Many women choose not to breastfeed for various reasons. If you choose not to breastfeed, there are certain things you should know about bottles, nipples, and formulas. What type of bottle to use is up to you and your doctor. Learn to be a careful shopper so you can compare prices and quality. Unless otherwise advised by your doctor, never cut a hole larger than the original hole in the nipple, because the baby may get too much food at once and choke. What you put in the baby's bottle is important too. Solid food should be fed with a spoon, not with the bottle. Never put anything but liquids in the bottle. Also, never add anything to your baby's formula unless you consult with your doctor first. Of course, your baby does not have teeth at first. Still, he is forming long-lasting food habits. So, if you teach him good eating habits in the beginning, he will retain these habits in later life. It is not necessary to add any sweetener to the bottle, such as sugar, corn syrup, chocolate syrup, or Coke, unless you're advised to do so by a physician. As we pointed out earlier, sugary foods are liked by bacteria. The acid produced by these bacteria can be harmful to your baby. Also, if you teach a child that sugar is good, he will insist on having it on many foods later in his life. Putting your baby to bed with a bottle is a bad habit to get started. Put only water in his bedtime bottle, unless you're advised to do something else by your doctor. Almost any food that stays on the teeth for a long time can be harmful. So, even though milk is a good and necessary food for your baby, it can also be harmful. The milk in the bottle will not be harmful if the bottle is removed after the baby has been fed. When the bottle is removed, the milk will not stay on the baby's teeth for long. Never put your baby to bed with a bottle or give him a bottle for all-day drinking. Most babies are weaned by 15 months, but check with your physician about how and when to wean your child from the bottle. As your baby gets older, he will learn to eat many different foods. A variety of foods are important for healthy teeth and a healthy baby. Here are some guidelines for planning meals for you and your baby. There are 4 major food groups from which you can choose foods for your meals. These groups are the dairy group, the meat group, the fruit and vegetable group, and the bread and cereal group. The dairy group includes milk, cheeses, and other dairy products. These foods help build strong bones and teeth. The meat group includes eggs, meats, fish, chicken, beans, and nuts. This group is good for bodybuilding and maintenance. The fruit and vegetable group naturally includes a variety of fruits and vegetables which are good for maintaining healthy tissues, including your gums. The bread and cereal group contains cereals, rice, breads, and pastas. This group is especially good for energy. In order to prepare a well-balanced meal for you and your child, you should choose a food from each of the 4 groups. For example, a well-balanced breakfast would include milk, eggs, orange juice, and toast. Of course, foods are definitely needed for your baby's health, but they can also cause dental diseases. You've already been taught what causes the acids which make cavities. Now, what can you do to prevent it? As your baby begins to grow, you will want to feed him other foods in addition to his milk. You still want to add cereals to his diet. You should choose a cereal with iron for your baby. Next, fruits, juices, vegetables, and meats should be added to the diet. You should limit your child's snacks to those which will not be harmful to his teeth. These could be snacks such as popcorn, apples, or carrots. Remember that your baby is now learning eating habits that will last a lifetime, and your influence on these habits is very great. Adding sugar to most foods is not necessary and will only cause your baby to think that the only good foods are those which contain sugar. Since your baby will now be eating on a fairly regular schedule, he will probably begin to want snacks. You should try not to feed your child in between meals. But if you must, try to choose foods which will not be made into acid by the bacteria. Avoid cookies, toast, and candy, because these foods do feed the bacteria. We sincerely hope that these thoughts and suggestions will help you care for your baby, because after all, your baby depends on you. If you have any questions, please ask your dentist or dental educator.